Hello, good evening. Hi, Dr. Lee.
Hi, good evening.
Good evening. So today we actually have another live session with Dr. Lee because like last week, Dr. Lee did share about the negative impact on our personal life if let's say our elderly parents or grandparents do have cataract, right, Dr. Lee?
Yep.
So it sounds very negative on our last session. So I would like to know, like, is there a light at the end of the tunnel, all right, for those people who are suffering cataract? Do they have like positive impact, in their life in this matter? I mean, being realistic, because every time we talk about cataract surgery and all this, but what kind of impact they will actually have, and how does it, affect their daily lifestyle after the surgery?
Yeah, I think from our last session, so it was a bit of doom and gloom, but of course, cataract, those that will read about cataract will know that actually it's a pretty straightforward procedure, and cataract surgery, that's the treatment for cataract. And the idea of me talking about the negative impact before is because I've realized that a lot of my patients have been suffering in silence for too long before they come forward. So what I'm trying to now impress upon most people is that don't do that to yourself, because right now, as we are going through the pandemic, the quality of life is already affected badly enough. So don't allow yourself to fester or suffer unnecessarily. Now, the positive impact, of course, are many. Once you remove that cataract, I've seen over the years the kind of things that my patients have experienced. It can be funny things like, my patients have said to me before, especially the ladies, right? Doctor, after you've taken my cataract, I realized that how wrinkled I am. They can see their face. They say, oh dear, you've made me look older. So now that they can see is a bad thing, but that's a joke, of course. So like what they actually mean is, small things like that, they don't notice. So there's a lot of positive impact. Number one, if you think about what things that they cannot do, and then suddenly when you actually restore somebody's vision, and it can be quite immediate, within 1-2 days, they can see well. And they can then go about starting to do things that they used to do or they stopped doing. So now I can say that, I have patients where, they used to go out a lot, or they used to go out with friends, or even maybe like play mahjong, and they stop because they can't see it. Now they can get back into that kind of social activity. And as you know, most people that have cataracts are usually towards the retirement age. And, when you're retired and you're used to working for 40, 50 years and suddenly you got nothing to do, it's a big problem. Yeah. So mental well-being, no doubt is not directly linked to cataract, but I've seen how, doing something simple like a cataract operation for a patient with dementia has actually improved their overall lifestyle, because now they can actually see, they can interact better, and it improves relationship with their family members.
True.
So as we know, dementia is it's a big problem now. I think there's no treatment for it as well. It's very sad to see your loved ones, struggle as they, go through the problems of dementia. And having poor eyesight will only make that worse. So I've seen that as well.
Yeah. It will actually also make their condition deteriorate faster, right, Dr. Lee? Because they're depressed and,
Correct.
they're so
Depression,
lost.
anxiety. As it is, they're already losing their independence because they're not able to look after themselves. And what more, they can't see. So when they can't see, it's going to get even worse. So I think, sort of mental well-being in terms of people with dementia, or sometimes even Parkinson's, I find that it does help. Yeah. So they get more social inclusion and participation with other activities.
Yeah, I think a lot of people shouldn't suffer in silence, which actually this is a very treatable condition, and it helps a lot in your personal lifestyle as well, even as basic things like what Dr. Lee have shared, you see. Hi, we have Arthur Yong joining us.
Oh, Arthur? Really?
Yeah.
Hi, Arthur.
His comment, I can attest to that.
Excellent. Can you explain what attest means? Okay.
Thanks for joining us. We have also Agnes and you.
Good.
Ms. Chang. Good. Yeah, thank you for joining us.
Yeah.
I think, Dr. Lee, for a lot of people who are actually at the younger age group, where they also develop cataract maybe in their 50s or late 50s, and which they are still working, you know. So I believe with the cataract removal, it actually helps in their productivity as well, right, Dr. Lee?
That's right.
In
I
terms
think,
of
course,
work and...
I think we talked about how, for nowadays, the working age has moved on, 50, 60, sometimes in their 70s. So their productivity is affected once you can't see. Now, when you remove the cataract, then you restore the ability to go back to their work. Not only just that, I think, nowadays, besides just work, a lot of people also are starting to look after themselves better, exercise, and, nowadays, because of the last 18 months, we also can't do exercise very much, but there are certain impact that when you actually have cataract, you can't see well. And also those people that were wearing a lot of glasses to help with their vision to the point where, maybe the cataract is bad enough, it doesn't help anymore.
Yeah.
Cataract surgery can help to reduce their dependence on glasses.
Right.
And that increases convenience. Because what happens then is if they're exercising, then you don't have this sweat going into your glasses and affecting your vision. Those that like to swim or scuba dive, there's a lot of activities, particularly for the outdoors person, that, a cataract surgery can actually correct your vision to allow you to do that better. Yeah.
And I believe like a lot of people will have this taboo undergo for a surgery. Actually, Dr. Lee, this for the cataract removal surgery or the procedure is actually a very simple procedure, right? It takes about like 20-30 minutes for the procedure, and also as a daycare procedure.
I think I wouldn't call it simple. I wouldn't want to simplify, or how do you put it, in a way to actually sort of make surgery sound as if it's so to be too nonchalant about it, because any sort of surgery is something that should not be taken too lightly. Now, cataract surgery has advanced so much over the years to the extent now, I think in my hands, in fact, surgery from incision to complete putting in the lens, it can be 10, 12, 15 minutes. That's very quick. And there's no pain involved, and the patient just lies there with some eye drops and you see some light, and then it's pretty much done in 10, 15 minutes. But there is a lot of planning that leads up to that actual process itself. And there's a lot of refinements in the technique and technology that's happened to allow that delivery of the care at that level. So what happens now is you still have to look after yourself. There has to be a prevention of infection. You have to put eye drops, make sure you don't get problems. And of course, don't straight away go back to manual physical activity like exercise or even playing golf, or definitely not swimming in the first maybe 1-2 weeks or a month, because you don't want to unnecessarily expose your eye, which has got a wound on it where you had your surgery and no stitches required. You don't want to get bacteria in and things like that. That's the most feared complication from any sort of eye operation, when you get infection into the eye. So simple, but in a way, you can call it oxymoron complex as well, because there's a lot of planning beforehand and a lot of looking after afterwards.
Right. So as what Dr. Lee have shared, overall, the increase of the social participations and the increase of productivity, and also better improvement in relationship among your family members, or even with your friends, I think this will also actually helps their self-esteem. Right, because they're more confident to be more independent, not losing their independence, right?
Yes, of course. I think what happens is, if you're having to depend on your carer, or for all of us now, we are independent enough to be able to drive ourselves to work or go and buy things. Or, for persons like I mentioned earlier with dementia as well, they can't even dress properly or clean themselves properly. Can you imagine they can't see to do anything else? So at least they regain some of that independence. They can see, at least they can feed themselves, perhaps they can clean themselves better. And, that helps, because after all, the circle of life is odd. I think you look at it, we come out as babies where we are dependent on our parents to look after us. And when we get older, we get more and more independent. But as we get older and we get aged, shall we call it, then we end up depending on children and depending. So it's like a whole circle.
Cycle of life.
Correct. So what happens now is when we are at that time, of sound mind, and we want to be independent, we want to be less dependent on other people. And that's why I think cataract surgery plays a role there, in making sure that, you still get that independence as we age. So of course, more to actually add on. I think I don't want to drag on and on this short live segment. The actual webinar will elaborate a little bit more. We're going to talk more tomorrow, aren't we, Anna? We're going to talk more about some of the choices you can make during cataract surgery, not during cataract, before cataract surgery with your surgeon, so you can actually adapt your vision or have the type of vision that you want after cataract surgery. So we elaborate more tomorrow.
Okay. So for those who would like to find out more and learn more about the advantages of these cataract removal procedures to improve your lifestyle, join us on this coming Thursday, 22nd of July at 8:30 p.m. Please click the link below to register, and then slots are limited, so you can actually join us via the Zoom, where you can have direct interactions with Dr. Lee during the Q&A session, or you can join us in our Facebook Live or our YouTube Live session as well. So for all attendees who are also entitled a free consultation, free eye examination with Dr. Lee, please don't wait and join us in this coming webinar with Dr. Lee. Okay, so thank you, Dr. Lee. Signing off from Dr. Lee and Anna from LEC Eye Centre. Bye. Thank you.
Thank you all. See you again tomorrow. Bye-bye.